Welcome to my podcast. Today I'm going to talk about another common case that you can see in the clinical setting or in the GB practice. So basically, a patient present to you. Of course, after you introduce yourself, double check the patient name and date of birth. A patient will present to you, usually a lady who has a lesion or a concern of a rash with pigmentation that she didn't even notice early on. However, she noticed the pigmentation and present to you of concern. Why does she develop that? So you need to ask some questions, of course, and inquire if the patient have any thoughts about the reasoning for the rash and what about. And if she has a recent thing that she introduced in her life, for instance, laundry detergent, or if she has a travel history, or she had done something that's out of her normal usual chores. So the patient might say that I was in a short trip with my friend for a birthday and I've been drinking lime margarita, sunbathing in a country which has a beach and sun. So anywhere that could be. The patient will say I might have noticed soreness or redness or itchiness, but I didn't pay that much attention. So I'll ask some probing questions, like, for instance, if there's any history of injury, trauma, if there is a partner, and violence, for instance, intimate violence. You need all of that to be ruled out. If there's any history of medical concern, or if she has any history of dermatological issue, and if she's taking any medication on a regular basis. So all of that has been ruled out, and there is nil. And she's only vigilant about applying sunscreen periodically on a regular basis. So after you rule all of that, and obviously the patient is concerned, you'll ask if there is anything, for instance, being done or tried or whatever. So the only thing she mentioned that she was drinking and bathing. That's it. So you tell her that I would like to have a quick look and just explore what about the lesion. So you find a pigmentation in a bizarre area, for instance, or could be linear or could be odd distributedly. And you need to link what was the issue that might cause that. So in that condition, there is a condition that we need to think of from the dermatological point of view. It's called phototoxic plant dermatitis or photodermatitis, which are commonly seen in people who's working outdoor, dealing with plants. Say, for instance, the gardener or children who are playing outside without growing plants around them, or in the food industry, for instance, who's handling cereal, or bartenders who are squeezing limes. So the compound which is the culprit in this condition is furocumarine and called cerulean isomer, which become active with the sun rays, ultraviolet A, and this will lead, of course, to photosensitivity reaction due to the damage of the DNA cell membrane that will trigger epidermal injury. And this, of course, causes cutaneous manifestation, like, for instance, skin irritation, itchiness, redness, vesicles, can proceed to bully hours after the exposure. And it can be trivial situation whereby the patient didn't notice only the pigmentation. So as I say, the distribution can be odd, can be bizarre, or could be linear if the patient scratch, for instance. And this will keep in the nature of the exposure, which means it's only in the exposed area. And of course, the patient, as I mentioned, might not notice only the post-inflammatory hyperpigmentation, which could last, of course, for weeks or months. On that condition, the patient will seek cosmetic or dermatological treatment, because most of the patients, they don't like pigmentation to stay in their skin. So in this condition, as I mentioned, the diagnosis is mainly clinically driven, and according to the patient history, you will make the diagnosis. And the management is basically symptomatic. So if it's acute, you will advise about cold compressor and avoid itching. So you might give antihistamine, non-sedative. Of course, simple analgesia if the skin is sore, because with the sun it can be really sore. And you will give emollient and avoid sun exposure. So those kind of cases can be seen commonly, especially, as I say, in the hot country, and especially if patient is just lying under the sun, not in the shade, and frequently maybe drinking or adding this lime thing or whatever, or there's plant around them. So in that situation, you need to think about this phytodermatitis. Thank you.